Welcome back, everyone. We're now joined by Las Vegas Metropolitan Police Department Sergeant Matt Kovacic as we discuss the fentanyl crisis in our nation and right here in this community. Thanks again, Sergeant, so much for being here. Councilwoman, I know you're excited to have Matt on. Matt, give us a little bit of background real quick. Your job with Metro basically is to do what?
So actually, I oversee our Office of Community Engagement that encompasses our behavioral health unit, our low-level drug diversion programs, our crisis intervention team, as well as our youth outreach and intervention programs.
Councilwoman, I know you were very excited to have Matt on the show because, as we've been discussing on this program, the fentanyl crisis is probably worse than most people could ever imagine.
Yeah,
it is worse.
It is. And just to give one more statistics, of the 1,400 people in Clark County that have died from opioid-related deaths, almost half, or 46%, have been from fentanyl. Wow. So it's really gripping our valley and our community.
You know, Matt, let me ask you that. We know that Narcan can be an antidote for an opioid. Does Narcan work on fentanyl? If someone has a fentanyl overdose, will a shot of Narcan even help them?
It does, but we've seen sometimes where you need more than one dosage. You know, there's multiple body cam videos out there where the officers are administering, 2, 3, 4 doses. Wow. Just because of the potency of what some of these individuals are taking.
Matt, Councilwoman and I have been discussing this. Give us a perspective on what law enforcement is trying to do to stem this tide, which has really become critical here.
A lot of our stuff, is educating the public. We, as an agency, we have obviously our narcotics team that goes out. They have their own youth intervention through the high schools and middle schools,
right.
Just to educate some of the kids on, like we spoke about, is one pill can kill. If the kids understand that, if they're not they don't know where that medicine or drugs, pills, whatever it is coming from, then they shouldn't be taking it. So a lot of our approach is educating people. Obviously, the byproduct of policing is the enforcement arm. Mm-hmm. But the more people realize how dangerous fentanyl and how dangerous these pills can be, or narcotics in general, the better we can combat this epidemic.
Yeah, this isn't something that you're potentially going to bounce back from. As you said, one dose of this. Councilwoman had mentioned earlier, such a small amount of fentanyl can kill you. If that's in whatever you're taking, it's going to be very tragic. So, and then Matt, I assume too that law enforcement is also working hard to find the people who are trafficking this into the country as well, right?
Absolutely. I mean, obviously, there's different approaches. You have to have the law enforcement, the enforcement arm of it, as well as the education. There's only so much we can do as an agency to try and stop everything that's coming in here. Vegas itself is on its own little island, so everything is brought in pretty much. So it's a difficult task as our agency has seen. And
then also too, Matt, I think that you're talking about educating. We've talked about educating the young people. Of course, it seems like it runs the gamut of people who might be taking this, educating people in general. But for parents, Councilwoman, you talked about you're the parent of young, of teenage aged kids. Obviously, there's some education that needs to take place for the parents as well. And Matt, what advice do you have for parents like Councilwoman Brune?
Well, I myself am a parent. I have 3 kids. My oldest is 18, or soon to be 18, fixing to graduate high school. So, I've seen it firsthand where, a lot of the kids these days just don't understand the severity of some of their decisions. But as a parent, your number one thing is you have to be engaged. You have to talk to your kids and be there for them and understand, the struggles and trials and tribulations that they're going through. As well as, they need to be educated and taught of the dangers, the inherent dangers that are out there.
Matt, talk again about what programs exist to help with all of this, to help educate the kids, the parents, and just to keep the community safer.
I'd be remiss if I didn't talk about one of our programs that we oversee at Metro is our LIMA program. Essentially, we partner with the 8th Judicial Court. We take, it's not for juveniles, but we take young adults from 18. Our oldest that's in the program right now is 81. And we take them, and it's a 9 to 12 month process that gets individuals that have been habitual drug users, low-level drug offenders. Instead of arresting them and keep putting them in the system, we give them the means and ways to become active members of society. So some people graduate in 9 months. Some people, it might take them 15, 18 months. But we've seen a very successful rate of those that graduate. In fact, I spoke about it in Henderson last week, and it's actually so successful that only 1.25% of our participants have recidivized, have been rearrested, reoffended, reused.
Amazing.
So if it was, if I had a magic wand, I would love to be able to trickle that down into the youth. But in the meantime, like I said, we go back to the educating aspect of hopefully preventing them from starting to use any kind of substance before it becomes a habitual problem later on in life.
Councilman, I know you were impressed by some of the stats that Matt just talked about, that ability to kind of keep people from falling back into the system when you were at the summit. What other points did you hear there that you think law enforcement could help with, or what were some takeaways?
Well, and I think that was just the first of many conversations. And what I love about that example is all of the jurisdictions right now are receiving opioid settlement funds, and that's the money that the drug manufacturers who manufacture these opioids now are giving to the jurisdictions because they realize that an overdose and folks addicted really are taxing the social service system, and so trying to sort of make amends for the incredible destruction that this has caused in some cities. And so that's a great example of a program that hopefully we may want to, or will choose to fund, and expanding it to young people, something that we could do with our opioid settlement fund.
Yeah,
So
take that money.
really exciting. And we've already seen that it's had a great effect with older people.
That's exactly what I was going to say.
So we should talk.
The impact there has been phenomenal. What do you think, Matt, connects to keep people? What are they hearing that turns them around? That's an amazing success rate. Is it just the message period about how deadly this can be, or what do you think?
I think it's a mixture of both. It's you give someone a chance to make a choice to make their life better. If someone's been a chronic user of the system, been arrested and released without any kind of help or any kind of avenue of becoming clean and sober, just by giving them that one chance, somebody might have not have ever given that to them before, or they did, and they just, at that point in their life, they just chose not to go down that path. So we see a lot of times when that persistent follow-up, continual engagement with them, you see that the people change. They want to get better, and they just don't know how sometimes, and we guide them along the way.
Yeah. I think to your point as well, with young people, with the community in general, if you give them the facts about how dangerous fentanyl is, or the use of drugs like you're saying, where you don't know where this came from, it could be the last thing you ever do if you're not careful.
Yeah. Well, and the other thing too we heard at the summit is that one of the reasons why youth are so vulnerable is that they're feeling so isolated post pandemic, and so trying to find a way to engage them and give them alternatives and really just sort of pull them out of being alone is really important. So trying to think about youth programs and sports programs, that can sort of connect those young people, because if they're engaged and connected, they may be less likely to,
It's a great point, and I think we talked about that in our social media conversation prior to recording this show. You talked a little bit about that, Matt, the programs where kids can get involved, give them something to do, especially during the summer months that are coming up here, where the kids aren't going to be in school, and if they feel isolated, they might decide to turn to something not so safe.
Yeah, that's one of the things that my unit actually specializes in, that we strive to get kids engaged, whether they're sports inclined. We have numerous sports activities, camps, programs that they can get involved in. Well, let's face it, some kids aren't good at sports, so some avenues is music, some is dancing.
Good point. Right.
There's no one-stop shop or one-size-fits-all approach to it. So that's what my unit is trying to broaden ourselves
Right.
and try and get as many community partners involved, because we ourselves as an agency, we will never be able to fix the issue without the support of you know, the city, the county, private entities.
So true. Yep.
You know, it's a systematic problem and a community problem,
Yep.
and we rely on, you know, programs like this to help us get our message out.
Excellent. Matt, we have about a minute left with you. It's been a great discussion, fascinating discussion, very eye-opening. Anything else you'd like to add before we have to say goodbye?
As far as like parenting goes, one of the things that we see a lot is kids are so involved in social media these days.
Right.
You know, and that's how they're buying and selling narcotics, whether it's you know, fentanyl laced, or maybe they don't even know if it's fentanyl laced. But you know, as a parent, you want to make sure that you're being involved in your child's life, but then monitoring their social media, because that same social media that the parent might be monitoring, or you know, swiping left or whatever, and watching, could be the same social media that your kid is buying illicit drugs that potentially could be laced with fentanyl from.
Yeah. Great advice. Matt Kovacic, thank you so much for being with us. Really appreciate it. Great information. Councilwoman, great idea to have him. So glad you went to the summit, and so glad that you brought Matt onto the program today. Learned a lot. So, well, we're going to take a short break, everyone, but when we come back, we'll tell you about some great events that are coming up in Ward 6 that you want to put on your calendar for sure. So please stay with us.